I am joined today by Heather Kelly, who is the founder of Fort Erie Healthcare SOS, and MPP Jeff Burch for Niagara Centre. We are here today to bring to the Premier and Minister Jones more than 3,200 letters that are asking for the reinstatement of 24/7 urgent care in Fort Erie and Port Colborne and 24/7 emergency surgeries at the Welland Hospital. These letters that individuals have signed are asking for this. They are looking at the loss of service in very fast-growing communities and aging communities. They are looking at the long wait times that we have in our emergency departments in Niagara Falls and St. Catharines, and also in Welland. They are looking at the long delays, offload delays for people in the ambulances to get into the emergency departments. And in some cases, it could be 10, 12, 13 hours. They are looking at the fact that with an aging population, people have difficulty going to an emergency department. Residents are looking at the fact that nearly a third of them do not have a family doctor. So their only recourse is to go to an urgent care center or the emergency department. Seniors are troubled by the fact that many don't drive at night. Many families and seniors are low income. They can't afford the high cost of transportation. Looking at public transit being virtually non-existent to be able to get from one place to another. The letters many people have signed, and they've also added something. So here's one. I have severe arthritis, and I had an incident where I was afraid I'd broken something early in the morning. I was barely able to drive myself the 3 blocks to Douglas Memorial just to find it closed. The subsequent 35-minute drive to Niagara Falls likely made the situation significantly worse. Fort Erie must have the 24 urgent care reopened. Or, Saturday my nephew was at the urgent care, and luckily it was when they were open because he had a heart attack and they had to revive him. We need to have round-the-clock urgent care and a full-time hospital. My daughter needed urgent care. She has asthma. They were able to give her oxygen and then stabilize her and bring her to the hospital. I adopted 4 children, special needs. I need access to local health care. So these letters show that there is such a need, and the Premier is able to make sure that 24/7 urgent care is restored and 24/7 emergency surgeries in Welland are also restored. I'll pass it on to Heather Kelly, please.
Thank you. I just wanted to let you know, we had all of these letters available to members of the community, and although there's a consistency to them, at the very bottom, as Sue had pointed out, they were able to add their own comments. And so I really hope that the Premier and the Minister of Health will take the time to look at the letters that are being submitted to them on behalf of the residents of the Niagara Region, and pay attention to the comments. You know, after the letters, we participated in the rally in Toronto on public health care. And quite frankly, it was awe-inspiring for many of us. We had just about 22 residents from Fort Erie, and we had another 27 from the Niagara Region, so we had a full bus. And the first stop was at Nathan Phillips Square, where the marchers were gathering for the walk down University Avenue. Others that couldn't make the walk, of course, went directly to Queen's Park, where we gathered to enjoy music while we were waiting for the groundswell of healthcare advocates. And watching from the front of Queen's Park while they came up the front lawn, it was simply amazing to look back and still see people coming down University Avenue, making their way forward. It was such a testament to the amount of people fighting to defend public health care in Ontario. And although I know that they say that you will never have to pay with anything other than your OHIP card, we also know that many smaller clinics are charging extra fees. But in Fort Erie, we were so impressed by this march. It was hard to believe that so many people showed up fighting for the same cause. And I don't know about anyone else, but I was so impressed by how organized the event was and how awe-inspiring it was. And it was all people there looking to keep our public health care system, our ERs, and our urgent care. And that's a fight that Fort Erie has been in for a very long time. The closing of some diagnostic imaging and laboratories, even ICUs, have been affected right now. And on June 1st in Fort Erie, we held a mini fundraising rally for people and surrounding areas. And we had about 45 people show up, and we talked about when the Douglas Memorial was in its heyday. And I'll tell you what, people keep telling me, oh, it's just about nostalgia. You need to get on track. You need to get up with the times. It's not about nostalgia. It's about a need. It's about a need for people to have 24/7 care available to them in their own community. And, not everyone can drive, as Sue has said. So I contacted a local cab company to find out how much it would cost me to go from Fort Erie to Niagara Falls Hospital. And it was $110 one way. And that might not be a problem for some people, but for a lot of people, it is a problem today. And how in the world is that any kind of equality of care? Yes, there's other transportation modes. Of course, you need an app for those, and not everyone in the community has an app. But if you have that app, it's still $35 or $40 one way. So this may work for some, but certainly not for everyone. There's a question of our relatives or our family who need to get back and forth to a hospital to be able to visit a sick relative or a child or a parent. The cost for some would be prohibitive. Niagara Health's response is that they're not in the business of transportation. This is a regional requirement. And the region refers you to the Transit Commission, and the Transit Commission says they're putting together a plan. A year after the fact that our urgent care shut down during the evening hours. One common theme was that we're in this together, and that the provincial government needs to turn their mind's eye to the plight of the people on the ground, in small and rural areas as well as in large city centers. Centers are closing. Diagnostic imaging is closing. And yet, they're just announcing that they need to have more available to people. It's not enough to say that they're building brand new hospitals when there are so many people left outside of that loop, looking for help right now in those small and rural hospitals that are being closed or temporarily closed at night, that are really causing the problem for most. We need our urgent care in Fort Erie restored to 24/7, and we need our hospital to stay open permanently for our community. The time to do the right thing is now. If the government, as they say, have hired 17,000 nurses and 2,400 doctors in the last year, where are they? They're not in Fort Erie. What plan has been put into place to help alleviate the number of people needing to use the emergency room because they don't have a doctor? Fort Erie and Port Colborne urgent care centers could be used to help prevent overcrowding in St. Catharines and Niagara Falls. I've offered that many times. We can be the answer to the overcrowding of emergency rooms in the Niagara area. Not everyone in our community drives, and that creates a transportation problem. If Niagara Health cannot manage to care for everyone, then it is up to the province to make sure people are not falling through the cracks. The government can stop funding private clinics and put the money back into the public health care system. Will they do the right thing for everyone, or do they only take care of their own? Thank you.
Well, I just want to thank, on behalf of MPP, Niagara Falls MPP Wayne Gates and myself, I want to thank Heather Kelly and Sue Hott, Fort Erie SOS, and the Niagara Health Coalition, the Ontario Health Coalition, for the fantastic job they're doing, giving a voice to people from our community who are very concerned about their health care in Niagara, and particularly in South Niagara, as both Sue and Heather have mentioned. We've had a reduction in hours at both our urgent cares in Port Colborne and Fort Erie, and a shocking reduction of emergency surgical services in Welland. And so folks are having to travel an awful long way by ambulance at a time when offload delays and other delays are already a real concern in Niagara. So there's a lot of anxiety in South Niagara. And we have to understand that this is the part of Niagara that's growing the fastest. It's aging. We have issues in Fort Erie that Heather has touched on with isolation due to ever-increasing storms, and people are very anxious when an emergency is declared in that area, and they don't have an urgent care to go to. So this is a real situation that's creating great anxiety in Niagara. We need our urgent cares. We need our emergency services, and we're going to keep fighting until we get them back. It's as I've said before, it's a matter of priorities. And if this government can spend $1 billion to get beer in corner stores a year earlier than it was already going to happen, surely we can have proper medical care in our community. So thank you so much for everything you're doing, and all the volunteers fighting for adequate health care in our community, and we're going to keep fighting. Thank you.
Thank you very much. Just to end, so what we're looking at, right now we have a reduction in services. Once the new hospital in Niagara Falls is open, what we're going to see is the Niagara Health plans to totally close the Fort Erie Hospital and the Port Colborne Hospital. Presently, we have 3 full-service hospitals in Niagara, which is St. Catharines, Niagara Falls, and Welland. Their plan is that there will only be, in the future, 2 full-service hospitals. Their plan for the Welland Hospital is to make sure that it only does day surgeries. There will be no medical beds. It will be a glorified urgent care center for an area, as Jeff indicated, is growing very, very quickly. Right now, it serves more than 145,000 people. That includes South Thorold, Pelham, eastern part of Waynfleet, and Port Colborne, and the city of Welland itself. So we do have a real problem. And this problem has been with us since the Niagara Health System, Niagara Region, was restructured under Mike Harris. And South Niagara has always borne the brunt of all the cuts. And we need to make sure that we have full service, adequate care for a growing population. And by the way, when the Premier comes to Port Colborne and indicates that we're having new industries, well, guess what? Where's the care for all the people that will be moving in? And what about if there's an industrial accident, etc.? What in the heck happens then? So we really are asking the Premier and the Minister to please step in and make sure that Niagara Health gives us 24/7 urgent care, 24/7 emergency surgeries, and make sure that our hospitals are kept. We need that. And they are the ones that are able to do that. Don't download that responsibility to Niagara Health. They're not going to do it. Thank you. Any questions?
Questions from the meeting?
Yeah, sure. Just for either Sue or Heather, you're obviously here today. Any chance you're meeting with Premier
Could you
Ford?
speak up, please?
Yeah, you're obviously here at the legislature today. Is there any chance that you're meeting with either Minister Jones or Premier Ford or anyone from the government?
Are we meeting with the minister? No, we're not.
No, we're not. Sorry.
Okay. Is that something you've tried to do in the last however many months, or?
We have done some contacts and haven't really received a great response.
Okay.
So we are, now that we have the letters, we're going to be doing a follow-up.
Mhm.
Okay.
Okay. Any chance you want to share what that not great response is like?
It was just a verbal response. Okay.
Thank you.
Thank you.
Thanks.
Thanks very much.
Thank you very much.